Hi, I'm Joe O'Connor, editor-in-chief for EBS newspaper in Big Sky, Montana. Today, I'm here with Dr. Jason Moore. Jason Moore holds a PhD in epidemiology and works as an emergency medicine PA. He was recently worked at a COVID surge at an ER in Harlowton, Montana. Most significantly that he's talked about is that for the significant cases that were at that hospital to actually be hospitalized, it appeared that most were unvaccinated. Dr. Moore consults for numerous businesses, including our publisher, Outlaw Partners, on developing customized COVID protocols. Dr. Moore, welcome to the show.
Hey, thanks for having me.
Appreciate it. I was wondering if you could just walk us through sort of the state of the union right now with where COVID is, the Omicron variant, just a general kind of statement there.
Yeah. So big picture, which I think most people are familiar with, is that a new variant came out. This time it's Omicron, and cases spiked. So increasingly transmissible, meaning more contagious, very similar to Delta, which is what viruses do to survive. Okay. And so we've had a surge. Bigger hospitals get a lot of numbers. Your urban centers become very, very busy, and you're adding the Omicron surge, the increase in transmissibility, causing more cases from Omicron with our other wintertime viruses. So you're getting a lot of folks that are feeling not very well, and those are the folks that are going into your emergency departments and really taxing the system.
Got it. Well, and so talking about COVID and Omicron, we are seeing a lot of people getting sick in Big Sky and in Gallatin County. Are any of those folks that are getting sick that aren't necessarily getting COVID, are they increasing the load on hospital staff?
Certainly. I mean, especially in this day and age, because we have folks that are very concerned about catching COVID. And remember, the symptoms of COVID are very similar to the symptoms of most of our other respiratory viruses, namely body aches, fevers, cough, those kinds of things. Overall feeling just pretty crummy. And a good handful of them also bring in your GI concerns as well, nausea, vomiting, diarrhea, which COVID can as well. So there's a lot of overlap and what we call a viral syndrome. And so you get a lot of folks that are getting sick and their symptoms do read very similar to that of COVID. And so they're going in and they're getting checked out, and just that increased volume of folks showing up at the emergency departments, at the urgent cares, that is increasing the tax on the system. Okay, that's more people coming in a system that's already feeling it because of the burnout for the nurses and the providers and staff in hospital systems.
Yeah, sure. Yeah, it's a significant tax on our frontline workers and doctors, nurses, all hospital staff. I mean, and it's flu season. These things happen on some level, and that's not to downplay the seriousness of COVID, but at the same time, I think it's important for people to recognize that health is a big component in any of these cases. And I was curious, how can people be healthier? How can they avoid COVID, the flu, or any other crud that's going through the system?
Yep. That's a really good question, because I think a lot of times we go through our lives, our very busy lives, and we forget about the basics. And managing these viral syndromes, whether it's COVID or whether it's influenza, as you mentioned earlier, is really about the basics. Okay. Number one, don't be around people who are sick. Number one. Number two, wash your hands. Don't touch your face. Right. And eat well. Drink plenty of water, keep yourself hydrated, eat well, take it easy on the alcohol, which gets hard around the holiday season. So you have a lot of people together and you have a lot of festivities going on, but really take it easy, keep yourself well hydrated, take care of yourself. Okay, take care of yourself. Those of you who are on medications, make sure you're staying true to them. Be compliant, take the medications as they're prescribed, and just really do a good job of overall health. But the biggie is really staying away from people who appear sick, family members, or if you're sick, stay away from them.
Yep. Yeah, people need to stay away from the offices when they're working, and if they're feeling sick. And I think that we've seen that goes a long way. A lot of these things haven't changed. A lot of this is the same as it's always been.
Correct. And if you look, the COVID guidelines that we now are all very familiar with, it's keep your distance, it's wash your hands, don't touch your face, all those kind of things. Wear a mask when applicable, when it's appropriate. Those are all things that are the basics. And that's really the rule of thumb for COVID was to follow the basics.
Got it. One last thing I wanted to ask you about was you have a thing called 456, and I wonder if you can tell us about that.
Yeah, that's something I give my patients just to make it easy. So, most of these viruses, when they come on, they kind of have a predictable onset of symptoms and a duration. Okay, as mentioned, you get the body aches and pains, fever, sometimes a kind of a low-level, non-productive cough, but overall you just feel pretty punky. And they last anywhere from 4 to 7 days. And that's kind of the duration we see with a lot of these wintertime viruses, whether it's this year or years past. It kind of has a very similar pattern. And most of these patients do not require hospitalization. They don't require a trip to the emergency department, but they do require some home care and with over-the-counter medications, namely ibuprofen and Tylenol. And so to help remember it, I tell people the 4-5-6 rule. It's 400 milligrams of ibuprofen, 500 milligrams of Tylenol every 6 hours. And you do that for a day or two. We don't keep going for longer term with medications, but for a day or two, the 4-5-6 rule works pretty well. And stay hydrated. That's the other part.
Got it. Got it. Great advice. Well, you heard it here, folks. Dr. Moore, Dr. Jason Moore, thank you for your time. Appreciate it today.
You're welcome.
Jason Moore holds a PhD in epidemiology and works as an emergency medicine PA. It's been great talking to you. I know we'll be doing this again soon, but I appreciate your time, and we'll talk to you soon.
Great, Joe. Thanks.